So without much further ado, let me introduce our first speaker, Dr. Katie Wakeham. So Dr. Wakeham is an NHS-based clinical oncology consultant working at Imperial College Healthcare NHS Trust. She's also the co-chair of World Radiotherapy Awareness Day, a global movement founded in 2024 to raise awareness and advocate for access to radiotherapy for all. She holds a fellowship award and charity funding to provide mentorship and training for NHS-based training and radiotherapy staff at the Uganda Cancer Institute, and recently co-authored a 10-year world-class vision on radiotherapy for Radiotherapy UK, which was delivered in response to a request from the All-Parliamentary Group for Radiotherapy and launched at the House of Commons in 2024 February. It supports the work of Global Coalition for Radiotherapy and to advocate for the integration of radiotherapy into cancer plans and improve access to quality radiotherapy. Well, earlier in her career, she has a very interesting career and worked in Uganda as a clinician, both in the government hospitals and Hospice Africa Uganda, and doctorate investigated cancers and oncologic infection. She was also the section head of radiotherapy at the IAEA, developing projects to improve access to radiotherapy in low and middle income settings. So let us all welcome Dr. Katie Wakeham.
Hello, and thank you to the Isrrt for the opportunity to talk today about World Radiotherapy Awareness Day. My name is Katie Wakeham. I'm a clinical oncologist working in London. I'm one of the founding committee members for World Radiotherapy Awareness Day, or RAD. Radiotherapy is vital for curing cancer, alleviating symptoms, and improving patients' quality of life. Access to radiotherapy is directly linked to improved survival for many cancers. Radiotherapy is also a highly cost-effective cancer treatment. However, around the world, there are significant regional and national disparities in the access to radiotherapy. Reasons include inadequate services, geographical barriers, insufficient workforce, and the lack of awareness of modern radiotherapy. One way to overcome these disparities is to create a Radiotherapy Awareness Day to provide a platform for the global radiotherapy community to join together and direct attention on radiotherapy to the public, media, and governments. The objectives of RAD are to firstly raise awareness about the role of radiotherapy as a cancer treatment. Second, to highlight the need to improve access to radiotherapy, which is a major issue globally. Third, to educate healthcare professionals, patients and policymakers about the importance of radiotherapy. And last but not least, to recognise the importance of the radiotherapy professions, including the need for an adequate and skilled workforce. So who should join RAD? We've been working with patient groups, radiotherapy societies, interprofessional groups, and industry on promoting RAD, but really the answer is everybody should join. Cancer is getting more common. It's approaching 1 in 2 people here in the UK. And as the numbers of cancer cases increase, access to radiotherapy becomes increasingly more important. Half of adults and up to a third of children diagnosed with cancer should receive radiotherapy as part of a curative treatment pathway. And we know that this is not happening, and many people are missing out on radiotherapy. We are making progress, but we have a lot of work to do. We announced the concept of World Radiotherapy Awareness Day in November 24 during London Global Cancer Week. A planning meeting was then held in March of this year, where the RAD date, logo, theme, and campaign messages were announced. The planning events were both in-person and virtual, and also recorded to ensure true global participation. Radiotherapy societies from around the world, patient advocate groups, and industry joined and spoke about the importance of radiotherapy and reinforced the need for a global awareness day. The interest and committed support from the broad radiotherapy community has been overwhelmingly positive. In terms of the date, why have we chosen September the 7th? Well, this is a landmark date for radiotherapy. It's the date that the first patient was treated in 1953 on the first dedicated medical linear accelerator at the Hammersmith Hospital in London. This date therefore represents the modern era of radiotherapy and the quality and safety we expect from modern treatment. The official logo has been developed through feedback and voting rounds from supporters. It represents a connected global radiotherapy community. People might see the lines differently or see different things within the lines. I see stylized isodose lines, the unity of our voice with sound waves spreading out across the world. RAD's overarching theme is one voice. This captures the fact that RAD is truly a global movement where the whole radiation oncology community, the world over, can join forces to help people living with cancer no matter where they live. We are testing out translations to get the same meaning in other languages, and these are now starting to appear on our RAD website. If you don't see a translation that you'd like to use, please do contact us and we can help upload that translation. The RAD website has been launched, and this has detailed information on the aims of RAD, along with news articles, information on RAD events, both local, national and international, all of our supporter logos, and a resource toolkit that includes downloadable logos, posters, banners, and lots of event ideas. The QR code that I'm showing will take you to the website, and I'll also show it again at the end of the talk. So what would we like everybody to do? The big aim is to show the size and strength of the global radiotherapy community, united in one voice for radiotherapy. So please join us on social media, follow, repost and share, sign up to our newsletter on the website, promote RAD, be this perhaps in society newsletters, giving talks or grand rounds, setting up a WhatsApp group, and plan events, be these walks, coffee mornings, tours of a LINAC for non-radiotherapy health professionals, or meeting with parliamentary or other advocacy groups. Many World Radiotherapy Awareness Day events are already underway, using the RAD resources from the website and posting on social media. The photo shows an example of a Visit a LINAC event in Australia, RAD walks in Tanzania and Namibia, conference sessions in Uganda and at Isrrt, and webinars. More events are planned with formal events at Aortic, Astro, CACA and others. RAD is not a one-off event and is designed to be a sustainable movement, so please keep planning events and promoting. We have a dedicated section on our website to celebrate events, so please share photos and testimonials. Just for my last slide, just again, please do visit the RAD website. You'll find links to the social media campaigns across the common social media sites. Please sign up to the RAD newsletter. Please follow, post and share your support on social media with your personal testimonials or details of any events. With one voice for radiotherapy from our whole radiotherapy community, we will make World Radiotherapy Awareness Day a success, and from there start to make a difference for people with cancer. There's the QR code again, which will take you to the RAD website. Thank you so much for listening today. Bye-bye.
Thank you very much to the Isrrt and to Steve Lacey in particular for inviting me to give this webinar today for World Radiotherapy Awareness Day, which is on this Sunday, the 7th of September. So I'm really happy to be here and to speak to this topic, which is about addressing the global challenges for radiation therapists with one voice. So in today's presentation, I have three key areas of focus, and these are radiation therapy access, recruitment and retention issues for radiation therapists, and education and accreditation of radiation therapists. And what is really important here is that I won't be dealing with these as separate issues because they are inextricably linked. So they really are linked to one another. So access is not just about buildings and equipment, it's also about having the right professionals like radiation therapists to run treatment machines. And this, I suppose, movement of radiation therapists around the world is also linked to both their education and accreditation. So these three issues really are kind of, I suppose, linked one to another. So by now, you're all familiar with the campaign theme of World Radiotherapy Awareness Day, which is One Voice for Radiotherapy. And of the campaign messages that we have for World Radiotherapy Awareness Day, the ones today, I suppose, that are linked to this presentation are one voice for every patient to have access to modern radiotherapy. So lack of access to radiotherapy is a global problem. And if we look at just the simple, I suppose, bricks and mortar and the actual equipment, over 200 million people live in a country that have absolutely no access in that context to radiotherapy. We will see that access might be slightly more nuanced than that in other regions of the world, and also in regions where there are limited, I suppose, options to access radiotherapy. And we know as radiation therapists that radiotherapy is such an important treatment in the cure and management of cancer. And in fact, 1 million more lives could be saved by improving access to radiotherapy. So it's such an important modality, as we all appreciate as radiation therapists. And so where I want to start today is about the access issue. So I took a look at the International Atomic Energy Agency, or IAEA, Directory of Radiotherapy Centres, or DRAC database. It may be familiar to some of you. And it's quite nice to go on and you can look at different things. But when I looked at it, I suppose what I want to draw your attention to is this particular graph here, which is about equipment per region. And what we can see there is that immediately straight off is the huge disparity in terms of the actual equipment in the various regions of the world. And also we have to, I suppose, look at these numbers, but also take them in the context of what is the population of those regions. So while Asia looks like it has quite a high number, you know, the population in Asia is obviously significantly higher than it is in Europe, for example. And look here at Africa and how low Africa, the number of linear accelerators in Africa actually is. So the DRAC database, while obviously with the caveat that it's a voluntary report, is a good stop. I suppose we're getting this broad picture overview of the number of actual treatment machines around the globe. And leading on from that, I want to just talk a little bit about this really excellent paper that was just published in the Green Journal earlier on this year, I think actually just about a month ago, which also uses the DRAC database, and it's Polish and German researchers who have looked at a geospatial analysis of the current disparities in global access to radiotherapy. And what's really interesting is that they then recommend where new radiotherapy centres would optimally be placed in order to get the most benefit. So I've just taken a couple of the graphs from this paper to show you. Obviously, you can read the paper at your own leisure, and I really recommend it. But this graph is quite nice, and it's talking about it's showing, I suppose, the access to radiotherapy centres for a patient within 2 hours of their home. And again, similar to what we saw in terms of the number of actual linear accelerators in the various regions of the world, you can see there that, you know, quite a significant part of Africa is in black. And black, of course, meaning that the population would access within 2 hours is 0 to 20%. And we can also see that scattered throughout Asia. We also see some of these black regions. Whereas we see 80 to 100% coverage in high income areas, so like Europe, Australia, North America, and some less than optimal, I suppose, access within 2 hours in parts of South America and Europe going into Asia. So then the authors went on to illustrate where new facilities, radiotherapy facilities, about 500 centres would optimally be located. And this is in terms of population coverage, which of course is really important. And thinking about, some areas in Africa, Nigeria, for example, has a massive population and it's growing and growing. Areas, obviously, of Asia, huge population. So in order to optimally locate radiotherapy facilities for growing populations around the world, this is where they should be located. And it's really not a surprise, again, to see that most of these should be located in Africa and Asia. But I certainly recommend that you have a read through that paper. It's really, really excellent and very, very interesting. And interesting as well is this very nice systematic review from a group in South Africa about the barriers to radiotherapy access in sub-Saharan Africa for patients with cancer. So what you can see there is on the left, they talk about the category of barrier and then what the actual, I suppose, granular reported barrier was, and then the percentage of papers that basically refer to that reported barrier and the reference numbers there. So it's a really nice piece of work. But what it shows, if we just go into it a little bit closer, is that the category basically of papers that talked about health systems and the barriers within the health system that result in a lack of access to radiotherapy are things like treatment centre characteristics, waiting times, how far people have to travel to the treatment centre, like we just saw in the previous study. So those, I think, are probably well known and understood by everyone. Things like socio-demographic factors, so socioeconomic status, becomes extremely important in countries where there is no access to public healthcare, and if healthcare basically has to be paid for, and obviously depending on income, then patients may or may not be able to afford to attend for radiotherapy. And then, of course, there's the inherent, I suppose, patient factors of age, cultural beliefs, the preference of the patient, things like life expectancy. But really quite interesting are the service provider factors. And the reason why I say these are interesting is that we see there are seven references about the lack of referral to radiotherapy, and a lack of understanding and awareness is a higher proportion. And that lack of understanding or awareness is not actually to do with the patient, but to do with the service provider, so the person who is referring. So, is this, be this a family doctor, be it another oncology professional or a non-oncology professional. And we see, I suppose, a similar issue with lack of understanding and awareness about the benefit of radiotherapy in terms of cancer cure and in terms of palliation and symptom relief in the wider medical field. And that's another reason why World Radiotherapy Awareness Day is so important. It's so important for patients, but it's also so important to make sure that the patients who require access to radiotherapy can actually get it. And nowhere, I suppose, is this better explained than by Jeff Delaney and Michael Barton from Australia in this editorial. And they, together with Mei Ling Yap, of course, have spearheaded the idea of optimal versus actual utilisation of radiotherapy across the globe. And in this recent editorial, what's really interesting is that they're reflecting on the optimal versus actual utilisation in one state in Australia. And what they say, if we just make it a little bit bigger there, is that from 10 over, I suppose, the period of a decade, the recommendations for radiotherapy have remained stable. They're accepted internationally. Access in Australia has never been better. There's reduced waiting times compared to a decade ago. There's this expansion of public and private facilities, including small facilities in rural areas, in order to try and serve that population. Huge efforts to promote radiotherapy by both referring clinicians and also to patients through campaigns such as the Targeting Cancer campaign in Australia, which of course has had worldwide reach and not just in Australia. But yet there's a serious shortfall between what the optimal utilisation of radiotherapy should be and what the actual utilisation should be. So that's really interesting, isn't it? Because that has nothing got to do with what we talked about first, the bricks and mortar, the equipment. It has to do with something else. And what the authors postulate are the 4 points on the right. And they don't necessarily give all the answers, but what they say is that, maybe our optimal rates of radiotherapy actually achievable. Whether investment in radiation oncology remains too low. And I think probably a lot of us here in various countries would certainly agree with that. Certainly here in Ireland, that is a major issue. And we often see that the radiation oncology budget relative to other oncology specialties is very, very low. And in the grand scheme of the wider medical budget is practically negligible. And then the authors postulate, well, what factors continue to lead to this difference between actual and optimal? And should attempts to improve access go beyond the building of facilities? And that last point, I suppose, kind of dovetails nicely into the second point that was on my list at the start, which is that access is not always just about the building, is it? It also has to do with who is actually on hand, what professionals are on hand to actually deliver treatment. And of course, as the deliverers of treatment, I, of course, would say that there is no one more important in that team than us as a radiation therapist. And certainly the recruitment and the retention of radiation therapists is a global issue, and it's an ongoing global issue. And this is a very, very nice editorial by the Early Career Committee of Isrrt, which is interdisciplinary of the radiation oncology professionals. And you can see from the author list there that everyone is included. And what they make a point about, I suppose, in terms of recruitment of radiation therapists, are things about like the environment that people are working in. If you're trying to recruit someone, you really want to have a very inclusive environment that people are stepping into work. So, for example, they suggest things like limiting the unconscious bias in the recruitment process and salary inequalities. And salary inequalities salary inequality is such a huge issue for radiation therapists, and the disparity in salaries for radiation therapists across the globe is really, really a massive inequality. Things also like improving, the coexistence of professional and family responsibilities. And we see that more and more in the, I suppose, post-COVID world, and also increasing the networking between junior and senior staff. And then there are points on retention of radiation therapists. Look at three areas, which are job satisfaction. So people want to, be very happy in their job and feel like they're making they're making a difference. And of course, as radiation therapists, we always make a difference to patients' lives. But job satisfaction, I suppose, has to go beyond the satisfaction of treating patients. It also involves the environment that you're working in. So things like having opportunities for career development, for example. So that could be things like in research, in education, in leadership roles, or in advocacy roles, like, for example, our day to day. They might not only improve retention, but actually also improve recruitment, of course. And then, of course, back to the maintaining a healthy work-life balance, which gets very important for people, particularly in countries where things like the cost of childcare is very, very prohibitive for people to work. and I suppose looking at trying to remove the barriers to flexible working. And that's very, very difficult for radiation therapist managers to actually handle, because of course people want to give, for example, people part-time options, but you do have to have a much bigger staff in order to be able to offer that to people. And so it's a little bit like a chicken and egg scenario. If you're in an area or you're in a time frame where retention and recruitment are actually really difficult in order to be able to do that. So it does require probably a little bit of thinking outside the box. And all of these as well, particularly in terms of the recruitment of radiation therapists, link back to the education of radiation therapists. So, it has always been, I suppose, the idea that professionals can move from, one region to another. And certainly that has always been the aspiration of the Bologna process in Europe in particular. But really, I suppose it does remain aspirational. And the reason for that, I suppose, is that there's a lot of factors that have to be considered when we discuss radiation therapist entry-level education programs. And that can be, in a country where there are a lot of societal issues. So, for example, there can be other medical societal challenges, so another disease that, takes a precedence over cancer, or otherwise, like things like, obviously, food provision for the population, political stability of the region, which, as we can see in various parts of the world, it does not exist at the moment. The political will to invest in education is very, very varied across the world. And then cultural issues such as hierarchical structures. But I suppose as a radiation therapist, regardless of all of these things, I always believe, and I always see from colleagues on the ground, that the interest and will of radiation therapists to improve education and to improve practice for better patient outcomes is always unparalleled. So across the globe, there are differences in what the radiation therapist does in their role. Therefore, their education, for the reasons that I just mentioned, can be quite different depending on the country and what's happening in the country at any given time. How the radiation therapist is perceived in the multidisciplinary team is also very different, I would say, not even from country to country, but sometimes even from centre to centre. And the opportunities for the development of the profession really vary again. So there are challenges everywhere. I mean, I think there's challenges in all regions. And the one thing that seems to link all of these, of course, is education. So what is the current status of radiation therapist education then? So there's quite a myriad of options. So we have the dedicated programs of 3 and 4 years, combined bachelor programs, which can be 3, 4 and 5 years. General healthcare or nursing bachelor programs are typically 3 to 4 years. Diploma programs still exist of 2 to 3 years. Apprenticeship models, and that's obviously over a variable number of years depending on the location. And then we still have on-the-job training, and on-the-job training can be without any formal qualification, can go anything from weeks to years. And this was a survey that we conducted a while ago, exploring radiation therapist education and training. And I suppose this is giving us a snapshot across Europe. So what you can see in the map here, and obviously one of the limitations is that there were not responses from every country. So, but what we can see here is that the course duration, the longer courses are in green, the shorter courses of 3 years are in the kind of red or maroon colour, and some countries like the Netherlands have 3 and 4 year courses. And the size, I suppose, of the dots refers to the amount or the proportion of radiation therapy specific content in that degree. So it's fine to say you have a 4-year degree, but if you have 5% radiation therapy education in that degree, does that really leave you in the most optimal position to work as a radiation therapist? So we can see that there really is quite a difference even across these countries, these selected countries that answered this survey in Europe. So I suppose just to summarise what was in that paper is that in Europe, the most common pathway is a combined programme of diagnostic imaging, nuclear medicine and radiation therapy. significant variation in the radiation therapy content between and even within countries. So between programs within the same country is very, very varied. The radiation therapy specific content of combined programs goes anywhere from between 10% to 50% across 3 and 4 year programs. And the actual input of our profession of radiation therapists into these programs tends to be very limited, particularly in terms of the academic teaching, which is done by other professions, which really is not appropriate. And most of the input of radiation therapists into the education of radiation therapists is in clinical practice education only. So that was kind of a snapshot of Europe. And then I suppose if we look at a kind of a more global picture, this is a paper that we had relatively recently in the JCO Global Oncology with an international group of researchers. And what you see on the right there, I suppose, are the distribution of radiation therapy centres in the countries which responded to the survey. So you can see, I suppose, we have quite a good response rate across the world and various countries. And what you can see, I suppose, again, in terms of the distribution of radiation therapy centres is what we saw earlier in the talk with the images from DIRAC, so very similar. So in this paper, I suppose what we found, or some of the key findings, were about the program length. So again, education programs varied in length from anything from 1 to 4 years in this case. Most 4-year programs were reported in Africa, and most 3-year programs were reported in Europe. So remember, of course, the data that we have here is based on what was reported in the survey. So, you know, that it does come with that major caveat. And again, we see the majority of programs as being combined across the specialties, and also with reduced, I suppose, radiation therapy specific content. I just want to speak just for a moment about the accreditation of radiation therapist qualifications, because the accreditation becomes quite a significant issue if radiation therapists are looking to move from one country to another to work. So what we found in this survey is that the authorities that accredit radiation therapist qualifications sometimes were just from the educational institutes themselves. Sometimes it was government ministries of health or education. Sometimes it was just radiation protection authorities or national registration boards or chambers. But in several instances, there was no accreditation of the qualification. And no accreditation of a qualification within a country really makes it difficult to change things like an education program, because there is no recognition of radiation therapist, or whatever the title is used in that particular country, as a profession. And so it's quite easy then for policymakers to kind of push back or bat away any attempts to try and improve the education of radiation therapists if it's not even an accredited profession within the country. So accreditation is actually a very, very significant issue in many countries in the world for radiation therapists. And in that survey, the international survey in the JCO Global Oncology that I showed you, some of the other results that we got from that, when we asked about what were the barriers in implementing a radiation therapist curriculum, didn't have to be a full, 3 or 4 year curriculum, but in implementing a radiation therapist curriculum at all. And I suppose from the responses, we could divide them into 2 broad areas. And the first was limited government and or support from the organisation. And that included commitment from the organisation that a radiation therapist curriculum could actually be brought into the organisation, staffing, so not having the appropriate staff to teach the radiation therapist curriculum, and also perceptions of how the RT curriculum actually matters in terms of the broader political and economic context of the country. And then the second broad area was lack of radiation therapy professional development. So things like deficiencies in leadership, so not having radiation therapists at the decision-making table or in those high leadership positions in order to make change. Lack of faculty development. Again, probably others from different backgrounds that were teaching on programs and really don't have any background in radiation therapy, so could not actually teach the subjects that are required. Logistical difficulties in curriculum implementation, and the belief that actually the curriculum doesn't really affect clinical practice. And of course, that's a very difficult area to be in if it's felt that what is taught didactically is not actually underpinning clinical practice. And of course, the whole I suppose, premise of a working curriculum is that the theory will underpin the actual practice. So just to mention the Train the Trainers project, which is focused at the moment specifically in Eastern Europe. And that is a project that I suppose tries to change this paradigm a little bit by, instead of trying to go directly to policymakers and, waive your curriculum and basically say, you should be doing this, because that never works, is actually working with radiation therapists on the ground and radiation oncologists and medical physicists, depending on the country, to try and, I suppose, bring about change from the bottom up. And this has been a joint IAEA-ESTRO project since 2008. It was the idea of Mary Coffey, whom I'm sure most of you know. It was embraced, luckily, by both ESTRO and the IAEA. And participants who come on this programme are on a 2-year cycle. So they have to come and commit to prepare and deliver either 3 short courses or events that are going to improve practice in their local situation. Now, the overall aim, of course, is by building up this kind of, I suppose, suite of small courses, is to influence the education content of national programmes. So I suppose what we have always aimed to do in the Train the Trainers project is to address what we've seen in those 2 surveys that I just showed you earlier, the absolute concrete evidence that there is a lack of radiation therapy specific education for radiation therapists in many countries in the world. And to support this really highly motivated bunch of radiation therapists who want to change things on the ground, to help them to come and deliver these courses or these events to their colleagues. And by doing so, also kind of, I suppose, educating them in terms of maybe some political astuteness as to how they might influence their educational institutes to improve the radiation therapy component of their programs. So I suppose what has happened in that now at this stage 17-year period is that, there is improved radiation therapy components in some programs, some pre-existing programs. A really positive move has been the appointment of radiation therapies onto the faculties of some programs, which is a really, really positive step. Radiation therapists who have gone on to follow MSc and PhD programs nationally and internationally with a view that they will be appointed onto the faculties of programs. A huge participation in European committees, national society days and annual conferences, and also integrated faculty in national conferences. So a much, I suppose, better profile of the radiation therapists in the interdisciplinary team and breaking down some of those hierarchical structures. And I suppose it would be a little bit remiss of me to finish without mentioning, I suppose, further on education. So everything I've spoken about before is entry-level education. So getting up to that standard where, hopefully in the future, if people do want to move from one region of the world to another to work, they can. Of course, being completely mindful of brain drain and all the rest of it, which is also a major issue, but which I won't go into today. But also to mention that in terms of education, while entry-level education may not be an issue in some regions of the world, sometimes taking that next step in terms of, remember what we spoke about in terms of retention, of job satisfaction, of moving on, of having an actual structured career pathway, that is absent in quite a lot of countries still, and maybe in countries that, you'll be surprised where it is absent, I suppose, if I put it like that. So just to keep in mind that education is still a global issue. Advanced practice and how we advance practice and consultant practice is, of course, still needs to be, I suppose, embedded in many countries of the world as well. And there are just a couple of papers from the European Society of Radiotherapy and Oncology on that topic, because of course I'm an estro person, so these are the ones that I show. So just to conclude then, I hope in the last 30 minutes or so, what I've shown you is that there's this huge linkage in terms of the global challenges for radiation therapists, in terms of access, so actually getting the patients that require treatment into treatment, recruiting and retaining radiation therapists in departments and in the profession in general, and also in education, and the real importance of accreditation of our of the profession in the various countries. And these are just, really, really, I suppose, interlink in a way that they can't be extracted one from the other. So with that, I just would like to end again with the theme and campaign messages for World Radiotherapy Day, Awareness Day. So remember, the theme is one voice for radiotherapy, one voice for every patient to have access to modern radiotherapy. And remember, that doesn't include just the building and the equipment, it includes us. One workforce voice for us, for well-educated and skilled radiotherapy teams, and one voice for raising awareness of radiotherapy as a safe, effective and advanced treatment. And remember, that's not just for patients, but that is also for other healthcare professionals who do not know about radiotherapy. And this likely has a knock-on effect on referral patterns around the world. And one voice that we will make lasting change for cost-effective and affordable for patients, global cancer control through radiotherapy. So with that, I just want to say thank you all so much for your support of World Radiotherapy Awareness Day in this our inaugural year. And I guess I will now be joining you live to answer any questions and continue this discussion with you. So thank you all very much.
that then is very powerful for policymakers, because cancer and cancer treatment start to get more on the agenda, because everybody wants to be part of something and sees the importance of something that cures patients so that they can go back to, a fulfilling and productive life. So, I think for those emerging radiotherapy centres, it's have your workflow in place, have your policies, sadly make some, which can become difficult decisions on who you treat, and ensure that those patients that you treat, you're treating for cure in the best possible way, in the shortest time as possible.
Thank you, Kathy. So I think we have time for just one last questions, before we close these sessions. Maybe so there's this question on in the last World Health Assembly, Isrrt collaborated with ISR and numerous organizations to develop a joint statement addressing concerns about accessibility of medical imaging services in low-income region. So can we do the same for radiotherapy to arouse the policymaker to pay attention to radiation therapy?
My answer to that is yes, please. I'm not obviously going to speak for the ISRT. Check way
Yes.
you do that. But I think that's a really excellent idea. I mean, I'd love to know about what the outcome was of what happened for the with the ISR, and with well defined metrics, going into writing any kind of document, that about what you want to get out of it. But for sure, I think, any kind of lobbying, and this is what World Radiotherapy Awareness Day is all about, any kind of lobbying of policymakers realize, hey, this treatment actually exists and it's very, very beneficial to your citizens, is always very welcome. So I would definitely welcome that, obviously with as I said, well chosen endpoints and metrics that are measurable.
Yeah, thank you. So I think international collaboration is a way to go in order to move forward our profession. Yeah.
Absolutely.
Okay, thank you very much to our excellent speakers, Michelle and Dr. Kathy. Yeah, so that now we have come to the end of the webinar. So please continue to check out all the World Radiotherapy Awareness Day activities and check out the website to find out more about the World Radiotherapy Awareness Day initiatives and the activities that in the coming days. All right. So thank you very much for your attention. And without much further ado, I'm going to close the session. Thank you very much.
Thank you, Chekwi. Thanks,
Thank
everybody.
you.
Thank you so much. Thank you.